Welcome back. Today we are going to talk about observing, reporting, and documenting. In order to effectively communicate, you have to have awareness, accuracy, and confidentiality. So, awareness means that since you are the person spending the most time with the resident more than any other staff member, you are in a unique position to find out about the resident's needs. So, say the resident has been having pain in their hip, and they know the nurse is busy, they know the med aid is busy, they get their medicine, the med aid pops in, pops out. That may be the resident's perception of what's going on, but you're the one that's there taking them to the bathroom, helping them get dressed in the morning, giving them a shower, all this kind of stuff. So they may tell you, or you may notice that they're having pain in their hip, or you may see the signs that they're having pain in their hip. If they're grimacing, if they're not wanting to put weight on it, if they're kind of holding onto their hip, especially as they move. So you have to know what to do with that information. That's where reporting comes in. And in order for you to effectively report, you have to have accuracy. So it has to be accurately communicated for that information to have value. If you have a resident that, say you have a resident that has a wound, or they've got a wound starting, and you go to the nurse and you say, well, Walter has a big spot on his butt, and walk off. How much information do you think that nurse is going to value of what you just said? Yes, they're still going to follow up on it. Yes, they should be, looking at the person's buttocks to make sure that there's no other wounds, see where it is, all this other stuff. But that may not make it easy for the nurse to be able to trust you with valuable information and with different tasks that are needing to be done. So you have to be accurate. So one of the things that you could do, rather than coming up, oh, well, Walter's got a big spot on his butt, and walk off, then you can tell the nurse where the spot is located. Well, it's on his right buttock. How big it is? It's about the size of a dime. What it looks like? It's red, but it's not open. And when I touch it, it turns white. That's a lot of good, valuable information for that nurse to know. And also when you spotted it and when you reported it, which you do need to report those things as soon as possible after you're done caring for the resident. But definitely, if you noticed it earlier, and say, well, I kind of noticed it earlier and I forgot to say something, because, people forget. I noticed it this morning, I forgot to say something, and it's still there. So I think you might want to look at it. That's going to help tremendously. And that will give the nurse confidence in you that you know how to do your job. And that's a very, very good thing to have. So another thing that you have to have when communicating information about the resident, you have to have confidentiality. So what you're not going to want to do with reporting that wound on Walter's butt, don't be going into another room where the nurse is providing care to another resident. If she's in with Mrs. Jones, or he's in with Mr. Smith, don't walk into the room and tell the nurse, oh, well, hey, Walter's got a big spot on his butt, and leave. No, that's not okay to do. So make sure that the information about the resident is kept private, not disclosed to others who are not directly involved in the resident's care, which would be the other resident in that case. Or say you do a drive-by where you talk to the nurse and the nurse is talking to the maintenance person. And you stop and say, well, Walter's got a big spot on his butt, and walk off. Did the maintenance person need to know that? Probably not. So you've just broken HIPAA and, given private information about that resident to somebody that didn't need it. They are not directly involved in the care of the resident. Yes, they may care for that resident and they may, feel sympathy for that resident and want to help them, but they are not providing direct care to that resident, so they really didn't need to know about that. So observation, let's talk about observation. So information can be collected through the use of the senses. you're going to see things. So let's talk about skin. You can see changes such as a skin rash. You can see the changes on, you know, that Walter's got a spot on his butt. It's red. His skin is normally pretty pale white. That's a big change. You can also see the differences in the color and consistency of feces. So if you've had somebody that's gone to the bathroom and had a bowel movement, normally it's a soft brown, formed bowel movement. Well, today it's black. It looks kind of tarry. It looks kind of sticky, and it smells. That's another thing that we'll talk about is smell. That's something that needs to be reported to the nurse right away because that person could have a bleed somewhere and it's coming out in their feces. So feel. You can feel changes such as someone having a fever. You can feel it on their skin. Changes in pulse. If they normally have a pretty good pulse, but today it's weak and thready. Or if they normally have, a pulse of 80 and today it's 40. That's a big thing that you can feel. Things that you can hear. You can hear changes such as the change in the breathing sound. How about if people normally have, pretty normal breathing, they don't have any trouble talking to you. Today they're short of breath. They have that dyspnea. They may kind of gurgle when they talk. That's a huge change that you can hear that needs to be reported. And smell. We have different changes such as the odor of urine and of poor hygiene. So you can smell when someone's urine gets nasty, when it gets more concentrated, when it gets more pungent, when there's more ammonia. That's an indication that someone is either dehydrated or they might have a urinary tract infection or a UTI. You can also smell poor hygiene. Now, this might be in the form of body odor, such as perspiration or sweating, and you can smell that. Or maybe the person that normally can take themselves to the bathroom and change their brief when they've been incontinent is having trouble with that, so they just don't change it. And you can smell the urine, or you can smell the feces. Now, one thing that we should not be using for our census is taste. So hopefully you will not be tasting anything of the resident. If you do for some reason, then report it anyway, just to make sure that all your bases are covered. So some different things about observation. You're going to collect information and compare it to previous knowledge of the resident. This is something that's very, very vital to do. So say you have a resident that normally is alert and oriented. So they're awake, they're talking to you, they know what's going on, they can have a conversation with you, you know that they are all there. Today, they seem confused. They ask you who you are, even if they normally know your name. They ask you, well, what am I doing here? They might ask you, well, how long have I been here? They're confused. So that's something that you will observe and compare that to previous knowledge. That's how you know they're confused. Because if you're somebody brand new walking into the facility that day and someone walks up to you and says, well, who are you? Why am I here? How long have I been here? Yes, that's something that might be normal for that person. We don't know if you're brand new. If you're brand new and you have that happen, stop and ask somebody. Stop and ask another CNA, ask the med aide, ask the nurse. Anybody that's working there will be able to tell you how that person normally is and if that's a change, because they're all observing all the time. So we will help to have you make good observations by knowing your residents, and that's going to take some time. So don't expect that on your very first day of work that you're going to know all the ins and outs of what each one of your residents likes, what they dislike, how they act. If they normally, on the 15th day of the month, they know something bad happened in their life 10 years ago. Maybe their husband died on the 15th of May. And then around the 15th of May, they get really tearful. You may not know that yet, and that's okay. It's going to take you some time, but that is important to get to know your residents. How about what is the resident's general appearance? Are they usually neat and tidy? Think about our ladies that like to go to the beauty shop and get their hair done. They usually will get that done and want to keep it nice, and some people will dress in their nicest pants and nicest tops and put their makeup on. And one day, one of the ladies doesn't want to do that. She normally dresses to the nines every day and puts on her makeup and goes out with a smile. Well, today she's just not feeling it. She doesn't want to get up out of bed. She doesn't want to put her makeup on. She doesn't really care that today is bridge day and that's her favorite activity. Something's going on with her. So that's where you can start your investigation. So, how about the condition of the resident's body? Has anything changed with that? Not taking care of their hair, having breathing problems, having mouth changes. Are they not eating as well because their dentures don't fit anymore if they've lost weight? That can happen. How about their activity level or ADLs changed? Their activities of daily living. Can they manage independently, or how much assistance is needed? How about those people that normally do get themselves up, get themselves dressed every day, and today they're lying in bed because they're having pain in their hip and it's too painful to get out of bed? That's a huge change. So those are the things that you're going to be seeing. How about their mood? Are they depressed? A lot of times people get depressed in nursing homes because they feel like they don't have anything left to live for. They feel like they don't have anything left to contribute. They, are just waiting to die. And that's something that you can see if, especially, you've had a change in the mood. If somebody normally has a bright, outgoing personality, they normally talk to you, they're a pretty happy person, and today they have the shades drawn and they don't want to get out of bed and they've got the cover over their head. All of those are signs of depression that you can kind of look out for and report. How about if the resident says anything about any concerns? Well, I'm not getting very much sleep at night because the person across the hall is making a lot of noise. That can be a big concern that needs to be reported as well. Because there may be concerns that are going on. You may work day shift and that person is normally happy-go-lucky during the day, but they have a terrible time in the evening or at night. Normally they don't say anything because, well, today's a new day. I'm going to have a good, fresh outlook on it. Today they might say something, so you need to listen. So some general guidelines for reporting. You definitely need to report any changes in resident condition or anything that just kind of seems different about them. So if you feel like something's just not quite right, I can't put my finger on it, go ahead and report it. A lot of times you have good instincts. CNAs know their residents and they know when something is wrong. Go with your gut. Tell your nurse, something's not quite right with Mildred today. She just seems a little off and I'm not sure how to put it. And that's okay. So some observations that should be reported exactly as you see, hear, feel, or smell them. So use that kind of observation. Well, Mildred's still in bed. She smells like she's had some urine, and she says she doesn't want to get up, that she's not feeling well. So use the residents' own words. That's very, very important to do. So collecting and giving information. At the beginning of your shift, the incoming staff will receive a report on the residents' needs from the staff completing their shift. This is very important to pay attention to, report. Because there may be things that, yes, you worked yesterday and Mildred was fine. Well, maybe she fell after you left last night and she's not been doing well since then. So definitely pay attention to report. So the report may be verbal or written, and hopefully you should be doing walking rounds where you actually go around and check on each person. So the CNA should definitely ask questions if you're uncertain of the information about the resident care needs. If they say, well, Mildred's not been acting quite right. Okay, what is she doing that's different? How do I need to respond to that? So get more information. You can always ask questions. So when you complete your resident care assignment, you will provide report to the nurse and to the CNAs for the next shift. So every shift change, there should be a report that says how the resident's been doing, if there's been any changes, and if there's anything to expect. So you will not be starting your shift until you receive report, and you need to receive a good report. So ask questions if you have them. You will also not leave without reporting off, which is handing responsibility to someone else. If you leave your shift without reporting off or handing off care to someone that is at least as qualified as you, if not more, so a CNA, CMA, or a nurse, that is considered abandonment, and that will be reported to the nurse aid registry, and that would not be good. So if this is not saying that you can't leave in the middle of your shift if you have a family emergency. That's not it at all. There's somebody else there that you can provide report to and hand off. However, if you're working someplace such as like assisted living or a home plus, those are a lot smaller places, a lot less staff. So if you're for some reason the only one on duty and the next shift comes in, unfortunately you cannot leave. You need to stay there and be the person providing care for that resident. So you've got to report off to somebody else. Hopefully that situation will not happen very often, but just kind of something in general, you have to report off to somebody else before you can leave your shift. You cannot just walk out the door in the middle of your shift. So your observations are very important because they may be used in a variety of different places. So your observations can be used in completing the MDS, or that minimum data set, can be used in developing the resident's care plan, and can help evaluate the effectiveness of the resident's care plan. So say you have a resident that is incontinent of urine, and the MDS has found out that when they came in, the resident was found to be incontinent of urine 2 times a day. And the care plan was developed to have CNAs take the person to the bathroom twice a day to prevent the incontinence. So what you chart in response to that will help evaluate the effectiveness of the care plan. And that will tell the MDS coordinator and the other nurses, well, okay, is the plan working that we put into place? Or do we need to modify it? Do we need to figure out what else we need to do for it? So this is very, very important to have accurate information because it all needs to match for reimbursement. So the CNA, your responsibility for recording or documenting information will vary according to where you work. So some places may have you document how people get up in the morning, how they get dressed, how much they eat, how they go to the bathroom, how they brush their teeth, all of this stuff. They may have you chart down to the most minute detail of the care plan and the ADLs. Some other places may only have you chart a little bit of stuff. They might have you chart the things that you actually help the person with. So say you work in an assisted living, and I use assisted livings and home pluses because they have a lot less stringent regulations than a nursing home does. And you do a lot less things for people in general. Not every place, but in general you do less hands-on care as a CNA. So say you work in an assisted living and you have a resident that needs help with a bath, but normally they can get themselves up and get themselves dressed. You have to cue them to go to the bathroom, so you just have to remind them, hey, it's time to go to the bathroom. But once they get in the bathroom, they can do everything else themselves. So you're not going to be charting necessarily on how they get themselves dressed in the morning. You're not going to be charting on, how they clean themselves in the bathroom. They're able to do that themselves. But you might chart on how much help they needed with a bath and the fact that you had to cue them to go to the bathroom. That's just an example of the kind of things that differ from facility to facility and depending on where you're at. So always go with whatever the policy is and whatever the care plan is. And whenever you chart, especially if you're doing the electronic charting like is required in all of the nursing homes now, then you will see exactly what's expected of you to chart on, and you'll have some kind of trigger, whether you have a little symbol up, or something is a different color, or whatever the case is. So, flow sheets or checklists, if you're still doing paper, these can be completed with very little writing. So, they may have a checklist of, did you get the person up? Did you do one person assist, two person assist, or a lift? Then you check the box. Then, did you get them dressed? Did they need one person assist, two person assist, or supervision? Check the box. So, those things are going to be a lot easier for you to write on. The progress notes, a lot of places will not have CNAs write progress notes, but just be aware that they exist, and just in case that you do have to write progress notes, then your facility should train you exactly how they want them to be written. But the progress notes are in the resident's chart or medical record, and these require absolute use of appropriate terminology. So these require a lot of that very, very objective data, such as if you, let me give an example. Say you think someone is sleeping. Okay, that's your opinion. What led you to believe that? Well, they're lying on their back in their bed, their eyes are closed, their breathing is even. I said their name and they didn't respond, and I can hear them snoring. That led me to believe that they're sleeping. So, all of the things that led you to believe that they're sleeping, that's the kind of stuff that you would need to put in a progress note, not your opinion. So, it's a very factual thing. But again, if your place wants you to write progress notes, they will teach you exactly what they want you to do. So, computerized documentation is used in all of the nursing homes now. Some of the assisted livings might still be on paper in the home pluses, but all of the nursing homes now are federally required to have computerized documentation. So just remember that the residence chart and associated documents are a legal record. So you want to document the resident's care and be accurate. One thing that I have heard throughout the years is always to chart like you will see it in court in 5 years. So make sure that you're accurate. You do not have to overdo your charting. Just give the facts of what you need to say and move on. But just make sure it's accurate and it makes sense. Because your charting in your resident record should tell a story of what you're doing to take care of that resident. So if there's gaps in the story or there's missing pages, that's really difficult to try to figure out. Okay, so what happened in this meantime? What happened from the time that they left the dining room to the time that you found them lying on the floor and their hips broken? So that kind of stuff is why I really stress, and I'm not trying to scare anybody, but that's why I really, really stress that the resident record is a legal document, and your facility should be providing you a lot of good training on how exactly to chart and what they expect you to chart. So some different general guidelines for recording or documenting observation information. Make sure that you write your entries or enter into the computerized chart as soon as possible after observation. Why is this? How many people don't write a grocery list and drive to the store and forget what they needed? I know that happens to a lot of us. That's why it's very, very important to write as soon as possible after your observation. If you cannot, try to keep a little piece of scratch paper on you and write stuff down, write the time, write whatever it is, the resident, all that good stuff. So you've got to have that written down, that way in case you're being pulled from one room to the next, and it's going to be a little bit before you can chart. You've got it written down, and that way when you go to chart, you've got something that says what you need to chart, and you haven't forgotten all of your information. So you always want to, if you're writing on paper, write all of your entries in chronological order. So write all of your stuff in the time that it happened. So if you have to write an entry for 9 o'clock, one for 3 o'clock in the afternoon, one for 2 o'clock this afternoon, one for 10 o'clock in the morning, and one for 8 a.m. So you're going to be writing one for 8, 9, 10, 2, and 3. Needs to go in that order, being chronological time, logical order. So each sheet in the residence record is identified with the resident's name. So you want to make sure that you have the correct resident. Use permanent ink, usually black in color, and every place that you work will tell you what color they want you to use. Some places used to use black for day shift, blue for evening shift, and green for night shift, whatever the case is. But usually black. Even if you are not doing paper charting, you need to have a pen and paper on you anyway. That way, just in case you do need to write down those observations before you can chart it, you've got it on hand. Write legibly. I know this is hard for some of us, but please write as legibly as possible. Because again, your charting is telling a story. We need to be able to read it. So use appropriate medical terminology and abbreviations. These are the things we already kind of went over earlier in the course, but just remember, some facilities will not allow abbreviations. Just check with your facility and go by their policy. Use correct spelling and grammar. If you're not sure, please ask. Correct any errors following the facility procedure, usually with a single line through the erroneous entry. So what this means is, say you are charting on Mildred, and you're charting that Mildred was, at 9 o'clock, she was lying in the bed on her back, had her eyes closed, snoring, that she responded to my voice, said she wasn't ready to get up, said she would get up later. And then you sign your name. Then you look at the top of the page and see, oh, that's not Mildred's chart. That's Joan's. What do I do? Draw a single line through all of your charting and write your initials above. If you record a wrong entry in the correct chart, say maybe you were charting about Mildred and she was, lying on her back, she was snoring, she said she didn't want to get up yet, but then you remember, oh wait, no, she was lying on her side. And most of the time, the position that somebody's laying in bed, if they're okay, is not really going to matter, but this is just an example. Then you remember, oh no, she was lying on her side, I need to fix that. So then you can write a line through it, initial it, and write your correct observation below. So that's what you can do if you make an error. Do not use whiteout, do not scribble it out, do not use multiple lines. One line with your initials. And always sign the record with your name and position. So your position, when you sign the record, if your name is Mark Smith, then you will sign it Mark Smith, CNA. So this concludes our observing, reporting, and documenting presentation. We are going to have some mock scenarios for you that we're going to ask you to write your observations and show us how you would document for that. And then we will practice this a little bit more in the skills lab. So please let your instructor know if you have any questions. Thank you and have a great day.